Well, and let's put this all into perspective. We are joined by Dr. Sreeram Chaulia, Professor and Dean at the Jindal School of International Affairs, joining us via Skype. Dr. Chaulia, thanks for being with us. So, the Prime Minister describes NAM as the moral voice of the world, and also, India playing a very significant role, 1/6 of the world's humanity, but blending democracy, discipline and decisiveness in showing a path, in a sense, to the world on how to deal with COVID. Put that into context for us.
That's right, Mark. We know non-aligned movement, in a way, has outlived its purpose after the Cold War ended, because it was, at the time when the world was divided into Eastern and Western blocs.
Yes.
But nonetheless, it has continued as a forum. And I think what is more important is not whether it is aligned with one power or the other today, but rather that it is the largest grouping of developing countries. 120 member states of NAM out of 193 members of the UN, which means that the majority of international community is a non-aligned movement. And interestingly, India is a prominent developing country and has always been a leading force in NAM, while China has not been ever a member of NAM. So in that sense, there are many advantages we have with this forum, and it is continuing in a new form. And today, Prime Minister obviously has attended a NAM summit for the first time through virtual means. In the past, we used to send, a vice president and so on.
Yes.
But he has attended because he realizes that this is an important forum through which we can promote what he called this global solidarity and this promote the cooperative gene. So right now, there's a lot of division and heartburn and ill feelings and narrow nationalism. And Prime Minister, I think he laid out a very broad vision of India as a promoter of multilateral global cooperation through forums like NAM. He's also been very active in the G20 and of course with SAARC, with our own immediate neighboring countries. All these multilateral forums, we have been, at the forefront in the last 2 months to make sure that, the world hears our voice, gets our wisdom. PM mentioned Ayurveda, PM mentioned yoga, PM mentioned, as you rightly said, our modern day wonder of democracy, decisiveness, and discipline, and how all these three can combine together. PM mentioned our online transfer of expertise and knowledge to other developing countries. So this is the time when they're looking for help, Mark. Because the UN is saying that Africa, which has actually got the largest number of NAM members as a regional grouping, is going to have 3 lakh or more casualties if coronavirus is allowed to spread without it being contained.
Yes. Dr. Chaulia, you did mention
that. As a leading power, we want to give and help these countries so that they do not see any of these body counts that people are foreseeing.
Yes, you did mention how the Prime Minister addressed this summit. It's actually the first time he's done so, and he also called for a new world order in a sense, post-COVID, because and you did mention the strength of multilateralism. Also, this is in a form South-South cooperation. It's developing countries, and we are definitely the largest in the game in a sense. So this is a significant forum for a post-world, let's say, a reworking of the system in a sense, where we require to have reforms of multilateral institutions.
Very much so, Mark. We have always been a big moral voice within. Through using platforms like NAM, but it's especially relevant now because some of the biggest powers, and Prime Minister has referred to this earlier as well, some very big and powerful countries are not doing so well with regard to COVID, and they have not really put themselves forward as the best example for others to follow. We are doing a reasonably good job. I mean, compared to many other power centers in the world. India has been able to control the pandemic so far.
Yes.
We are not being boastful, but we are simply stating the facts, which is that we have got a model of social and political cooperation of the society with the state, and fairly a robust medical system that is getting its act together. And we have some good practices to share for other countries to emulate.
So let me come in on that, because this is a point which is important to talk about. The Prime Minister mentioning that India is the pharmacy of the world. And we have some practices, as you said, Ayurveda is one of them, where we, simple remedies to boost immunities. All these are very much in demand at this point in time. And, when the world is sort of pulled back economically because of the COVID crisis, here's a chance, for Indian pharmacies or pharmaceutical companies rather to take a step forward, and even our traditional methods of medication to take a step forward because they're acceptable in dealing with respiratory illnesses, and we have some sort of results as well to show that it's positive. Apart from that, India has already, as the Prime Minister was saying, been helping a lot of these countries, 59 of them being NAM countries, with medications. In a sense, we're already playing the role.
Yes, Mark, very much so, but it needs to be re-emphasized. And I think the NAM summit is the right forum for the whole world to hear this, because, PM also mentioned some negative coverage and, fake news about India and all these things which have been spread by some malign interests. So it's important. Yes. And the health products that the PM mentioned, timely access to health products and healthcare, this is where India has a lead. We have an advantage, and we have a kind of advanced manufacturing capacity. Even with vaccines, Mark. I mean, we have the capacity to help the whole of Asia, Africa, and Latin America. Not to mention the developed countries which are also looking for our help. I mean, if you look at, for example, the Oxford University cooperation with the Sreeram Institute in Pune, Maharashtra, is one of the likely, rays of hope for the whole of humanity that we can find a vaccine. So Absolutely. India has a foothold in all the solutions.
It's not science that India has no expertise in. Creating vaccines, we are pretty good at it. We have had that ability. I mean, even new vaccines, we can be at the forefront. This is not something that it's a game where we have to catch up. We are right up there actually, and we can definitely take advantage of this time when the world is looking for a new vaccine. Possibly, we are in the race. We don't know what's actually happening. We are hearing news, but we could be in the race where, the vaccine can actually even emerge from India. And that would be a huge boost. But apart from that, let's put into perspective multilateralism itself. What do you think? I mean, there was the relevance of NAM in a post, bipolar world. What is the relevance of NAM? People are going to ask now. We see that NAM has got a new relevance after COVID.
Look, Mark, I think institutions are sticky, even if they outlive their original, purpose, they still manage to be forums where large groups of countries can come together. They have formal mechanisms like summits and ministerials and dialogues and all these things. So at the level of disaster preparedness, we are promoting NAM mechanisms. At the level of the sharing of medical practices, we can use NAM. NAM can also become a means by which we can consolidate how frugal innovation can help, because all these developing countries cannot afford to have massive, healthcare budgets. We don't have those. Yes. And secondly, the bailouts, even the economic bailouts that are coming out as a cushion against the losses being caused to industry and agriculture and service sectors. Again, there we must find our own path, which is under conditions of scarcity and limited resources. So right. I think these are areas where, you cannot have, for example, you cannot compare Australia and Angola.
Okay.
But you can compare Angola and India. And there's more that Angola can learn from India than from Australia. Just to give one example. So I think the South-South model is going
Dr.
to become more relevant.
I'm told that Praful Ketkar is also joining us in this discussion. He's editor of Organizer. He's also on Skype. Thanks for being with us. I'd like to thank at this point in time Dr. Sreeram Chaulia for joining us on this discussion. Thanks, Dr. Chaulia, for your inputs.